Welcome to the mHealth Mobile Technologies to Improve Community Health webinar. Thank you all for joining us. It's my pleasure to be here. My name is Brian Leaf, and I'm the Community Engagement Coordinator at the South Central region of the National Networks of Libraries of Medicine. So by the end of this presentation, what I'm hoping is to really demystify mHealth, mHealth or digital health, whatever you like to call it. We're going to look at a short history of consumer and clinical mHealth technologies and really set the stage for its potential by looking at how it's being used in a variety of settings. Then we're going to take a look at some authoritative health resources and research tools for exploring mHealth and digital health more. This isn't a technical presentation at all, but I am hoping that by the end of the presentation, you'll have ideas about possibilities regarding programming, partnerships, and creative uses of technology, and how it might play into your practice or how you might support your audiences. So defining mHealth. So this is a definition that I grabbed from Health and Human Services. It's the use of mobile and wireless devices such as cell phones, tablets, etc., to improve health outcomes, healthcare services, and health research. Within this very simple definition, there's really a lot to unpack, and where I'm going to start is telemedicine. Telemedicine, I think, is probably the most common terms out there, and it generally refers to the communication between a patient and provider over a distance through electronic means. So most often I think of Skype-type technologies, video technologies. Here are a few more terms that you'll see if you look up telemedicine. We have real time, so that's referring to live video. Synchronous and real time is live video. Asynchronous would be sort of any sort of communication that takes place over a distance. So that could be email. If you've ever logged into the dashboard with your healthcare provider and gotten information that way, that would be considered asynchronous. You'll also hear, or you'll also read the term store and forward, which is sort of used within healthcare settings to talk about how things like X-rays might be passed on from provider to provider. I also like to differentiate between originating site and distant site. So originating site is usually defined as the location of an eligible Medicare beneficiary, usually meaning in a county outside of a metropolitan statistical area or a rural health professional shortage area. So this is actually where the patient is. That might be their home, depending on the state, or it might be an office where they're allowed to do that. And then the distant site is where the practitioner actually is communicating from. So I sometimes think that these terms can be a little confusing, but that's what that means. Sometimes you'll also see the term telehealth, and telehealth would be telemedicine, as I've defined it here, plus other non-clinical uses of IT, such as continuing education. So maybe in a way this would be considered a telehealth session in a way. E-health. E-health is sort of an obscure term that I think originates from sort of the 90s, the practice of putting E in front of everything. And it's more obscure. It's a term that includes health, technology, and commerce. But if you're trying to do searches or research around mHealth or telemedicine, I think using mHealth as a keyword, telemedicine, digital health actually, I don't list it here, but digital health is also one that you see very frequently. Okay, so I like to start with a little bit of history. Anyone who's attended my face-to-face presentations knows this. I usually like to do a deep dive into history, and with mHealth or telemedicine, that's no different. So one of the first instances of what I'll call modern telemedicine was the long-distance transfer of electrocardiograms in 1905. So it goes back pretty far. Sorry, that's one of the first instances of telemedicine. But when I think of the first modern uses of telemedicine, we have to go back to the 1960s. NASA was called upon to apply space technology to basically Earth applications. And in this case, to rural communities in southern Arizona. So I'm not sure if any of you were already familiar with this program, StarPack. That's what I call it. I don't know how it's actually pronounced, but StarPack stands for Space Technology Applied to Rural Papago Healthcare. And the thing with rural communities is that oftentimes the only expertise will be at the level of PAs. PAs will be, in rural communities. And this mirrored the availability of providers, this resembled what your situation might be in space, the training that an astronaut goes through. It's actually very intensive, and it's about the same type of training that a physician assistant would go through. So I thought this was a really interesting thing. If you look up StarPack, you can find the history of it, I believe, on the NASA website. But they go much deeper into how programs like this really expanded the use of telemedicine here on Earth. So this is a stock image of a man taking his own vital stats. When I talk to people about telemedicine, it's kind of interesting. I actually had a conversation with my own doctor a few years ago about telemedicine, and he never heard of it. I like to talk about telemedicine in this presentation because I think it's an important model to think about when we brainstorm ways later in the presentation, the ways in which other consumer devices could be utilized from a public health perspective, or even from a clinical perspective. Telemedicine is a very practical and important solution for reaching rural and aging populations, but more importantly than that, we all know that there are a lot of laws around how medicine can be practiced, and telemedicine is no different. More than half of the hospitals in the United States are turning to telemedicine. And if you look at Kaiser Permanente, which is the nation's largest nonprofit integrated healthcare system, they actually reported in 2015, 4 years ago, that over half of its 110 million patient interaction were e-visits. So telemedicine has matured over the years, and especially in California, and increasingly in recent years with a lot of other states. A lot of laws are changing every year. It's important to keep track of what's happening because in regards to the healthcare provider and patient relationship, what you can do depends on what state you're in. By the way, I'm not a lawyer, and none of this is legal advice. I'm in the South Central region, which has 5 states: Texas, Oklahoma, Arkansas, Louisiana, and New Mexico. I know many of you are from outside of that area, but doing research around telemedicine and digital health, I'm a little bit more familiar with some of the laws that have been passed here. So it was only a couple of years ago that Texas passed bills allowing new doctor-patient relationships to be established without an initial physical meeting. Before 2016, doctors doctors who wanted to practice in Louisiana via telemedicine had to have a physical office in Louisiana. So that was a barrier for a time. In Arkansas, before August 2017, patients couldn't take calls in their own homes. Their originating site couldn't be their home. They had to visit a designated site, an originating site, as I defined it earlier, to communicate with their doctor. New Mexico has been fairly supportive, and recently I just read that this year that 2 health plans in New Mexico launched a phone-based telehealth service, which allows patients to call a number on the back of their insurance card and get a consultation with their doctor after initial screening. So as you can see, the laws and what you're allowed to do vary from state to state. But again, this isn't legal advice, and I encourage you to look it up in your own state. I'm going to paste a resource into the chat box right here. And that captioning URL has been pasted in there by Felice Harper. So if you need captioning, go ahead and take a look at that. So this link that I just pasted in here is an organization that tries to keep track of telemedicine laws and policies. And there are a lot of sites out there that look at that. That's just one that I've used before. Okay, so a little bit more history. I'm not sure if anyone's familiar with this, but does anyone here use? And you can share as little or as much information as you want, but if you use some sort of fitness device, you may have heard that people should strive for 10,000 steps a day. But does anyone know the origin of that idea? Or does anyone use a fitness tracker? And if so, what do you use? Fitbit. Thank you. Lots of people using Fitbit out there. Great. So the MAP-OK is this pedometer that you see right here, and it was a university professor who was concerned about the rise of obesity in Japan and wanted to promote daily activity. He figured that the average Japanese person walked 3,500 to 5,000 steps a day, but increasing the steps to 10,000 meant more calories burned, so that wouldn't be a bad thing. And it was also a really, really great way of marketing the device. So it's not so much an evidence-based practice, but it's one that's taken hold for, over 50 years now. So I don't know if anyone, just by looking at this picture, can tell what this is and from what country this is. But just to give you a little context before I reveal who this is, and you can guess, this is just a clue. This is a national cross-country ski team. So Fitbit, which many of you use, came onto the scene in 2008. But it was actually in 1977 that a battery-operated fingertip heart rate monitor was developed for this team. I don't really see any guesses here, so I'm just going to go ahead and tell you. This is the Finnish national cross-country ski team. The professor who developed this went on to found Polar Electro, which is better known as Polar today. A company that's still going strong in terms of sort of high-end fitness devices. So chances are you or someone you know uses a smart device. A Pew study published in 2013 found that 7 in 10 U.S. adults track a health indicator for themselves or for a loved one. But heart rate monitors, like the one that was developed for this team, sleep trackers, and pedometers aren't the only way of tracking health. So before I tell you just another quick informal poll, who knows the most common type of health sensor? these pictures that we see on the right are some interesting developments. The one on the top is a smart ring that premiered at the Consumer Electronics Trade Show in Vegas, I think 2 years ago. The one on the right is that tattoo that you see is for glucose monitoring. And okay, I'm seeing guesses here. So yes, blood sampling sensors, glucose monitors are the most common types of sensors. So that's what we have on the right is something that's sort of been in development. But there are lots of other types of devices. So a device that we brought over here and tried out are patches that were marketed for a while to help monitor skin temperature that sync with your Bluetooth phone. So a patch that you just attach to the inside of your armpit that lets you monitor the temperature of perhaps you or your child. In 2017, the FDA approved the first digital pill that works with a wearable patch to treat episodes associated with bipolar disorder, schizophrenia, and depression. An Australian research team published a human trial study about an ingestible capsule that can sense different gases in the gut, which in time could help us improve colonic health and how we understand the impact of food on our bodies. And then in that lower left-hand picture, you see a device that was also cleared by the FDA. It's the first over-the-counter carbon monoxide sensor for consumer use in proprietary smoking cessation program. So I see a question in the chat here about how the tattoo works. I'm not sure. I know that this has been. I know that it's a university that first premiered it. If you look up tattoo glucose monitoring, I'm sure you'll be able to find it. But I don't know the technical details about how it works, unfortunately. If you're interested in learning more about a lot of these technologies that are up and coming, wearables and other clinical technologies, I haven't gone over every single one. There are lots of mobile or remote patient monitoring technologies that aren't telemedicine. They're just used in hospitals. Or if you're just interested in what people are trying to develop, this is a great conference to go to. HIMSS, I visited a couple of years ago, and it was just absolutely insane the types of technologies that people were trying to come up with, and they premiere a lot of this new healthcare technology here. Everyone's trying to get in on the healthcare technology business. Sometimes companies get ahead of themselves. For this next section, I'm going to talk about several technologies, and it's not meant as a direct criticism or promotion of any technology. I think it's just good to know about some of these things to see, what's been happening in recent years, and maybe a little bit about where we're going. So you may recognize this headline from about 5 years ago. Google partnered with Novartis to make smart contact lens. It was supposed to be the next great thing after Google Glass. I'm not sure if any of you tried on Google Glass or had a Google Glass, but there were two products that they had in the works. One was a smart lens that could measure glucose levels, and the other was an auto-focusing lens for people for farsightedness. Neither of these things have quite worked. It turns out that the way the contact lens worked for measuring glucose levels was it was supposed to use tears, but it turns out that that's an unreliable marker for blood sugar levels. And then getting electronics in lens that small to transmit data is also very difficult. So this might have been a little bit premature, but people, companies out there trying. Another technology, again, this isn't a promotion. This is, I want to give an example of sort of different technologies that are and aren't working. Propeller is a company that is meant to help those with asthma and COPD, chronic obstructive pulmonary disease, self-manage a little bit using data. So public health programs often try to tackle tobacco use prevention or reducing occupational exposure to hazards that cause COPD. And this is an example of the technology. It's a little device that connects to your inhaler. And whenever you need to take an emergency breath, you use it, and it sort of collects live environmental data that's around you. It also asks you to input some information to help you figure out what's the cause of your emergency, to help you reduce the need for emergency inhales in the future. So just a couple different companies have been trying to do interesting things. On an institutional level, it was announced in 2017 that the Precision Medicine program, otherwise known as the Olivis Research Program, selected Fitbit as a way of starting to gather data. And at the beginning of this year, they announced that the launch of the Fitbit Bring Your Own Device program, where participants in the program can choose to share data and try to enhance research in that way. You might have also seen this in the news, the Apple Heart Study. So atrial fibrillation is a common type of arrhythmia. Arrhythmia is an irregular heart rhythm. AFib can cause the heart to beat faster than normal, and the upper and lower chambers of the heart don't work well together, which can lead to feeling tired or dizzy. Blood can also pool in the heart, which can increase risk or stroke or other issues. Well, the Apple Watch, it takes your pulse. And when I first started doing my research, Apple had just announced that they had recruited 40,000 participants into a study to see if Apple Watches could identify irregular heart rhythms, since it does monitor heart rates. Just a few months ago, Stanford Medicine, which conducted the study with funding from Apple, announced preliminary results that looked pretty promising. So in large-scale research, we also see use of consumer devices, being tested a little bit more comprehensively. But if you do look into public health interventions or any sort of health program interventions, devices aren't necessarily a shot yet. I was reading an article, and it cited one of these studies as evidence that it may not be the panacea that we're all looking for. This randomized clinical trial from the University of Pittsburgh compared a standard sort of intervention to an enhanced intervention that used a wearable device, and the results were actually better than the standard intervention versus the enhanced intervention. I'm not making an argument for either or. There are literally hundreds of studies that are out there now, but the evidence is still growing, and it's still a little bit mixed. So I mentioned randomized clinical trial. I want to introduce sort of the first resource I'm going to talk about today. Many of you may already be familiar with Clinicaltrials.gov. This is a product from the National Library of Medicine, and it's a database of privately and publicly funded clinical studies conducted around the world. It's important to mention, it says here on the screenshot that I took, listing a study does not mean it has been evaluated by the U.S. federal government. And actually, there's been recent news about this. So just because you're listing clinical trials doesn't mean it has been a vetted study. But what it will have is up-to-date information about current clinical trials. You can search by condition, or you can search by other terms, and you can filter by what phase a clinical trial is in, location, and many others. So I'm not going to go over phases of clinical trial too much, but these are generally in order to get something approved by the FDA, whether it's a new program that uses a Fitbit to try to improve health outcomes, or if it's a drug, it has to move through phases of a clinical trial, starting with a small group to assess risks before moving into larger groups to build evidence for that. I mentioned clinical trials because it's actually a great way to figure out what's on the horizon, what's been effective, or what studies are people doing around mHealth, digital health, in current health programs. So a while back ago, I looked for mHealth, and I collected into this spreadsheet just a random set of mHealth studies from universities around the United States. And you can see that the conditions and diseases that people are trying to tackle are some of the top causes of mortality in the United States. But when you look at the intervention and treatment, it's not just the wearable itself. People are using a Fitbit device, but they're also using text messages. They're also using surveys. These programs are often used in conjunction with other programs. Are often used in conjunction with existing programs, like sort of that standard intervention that we saw in that Pittsburgh study to measure the effectiveness of mHealth. So clinical trials, I think it's a really great and interesting way to do more research on what mHealth studies are being done out there. So what is health tracking good for? We know that the results might be a little mixed, but in this study that Pew did again in 2013, 34% says just collecting the data has had an impact on the health decision. 40% say it has led to ask doctors a new question or seek a second opinion, and 46% has changed their overall philosophy of health. And you may compete with others, or you may know other people that compete with others, but just having that information available, I think, seems to have had a positive impact on people's health. So now I'm going to switch gears a little bit and just talk about health literacy. Many of you are probably already familiar with this definition or a similar definition. Health literacy is a degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. Just like digital health or mobile health, there's this statement, there's a lot to unpack. When we think about the spectrum or continuum of activities that go into healthcare and how we interact with healthcare and how we take care of our own health, it's a very complicated picture. And so when I think about digital health or mobile health or telehealth, as a librarian, I definitely think about how we search for information. So we're collecting all this data. People are using their Fitbit devices or other devices, but if you work in a medical library or library situation, you probably already know that most people are still using Google to search for health information. This article is one that you've probably seen. You've probably seen a lot of similar other headlines, and this is one that I had seen a while back. I would say on any given day in this quote, it's probably at least 50% of patients who say something about the internet. Probably less than 25% of the time does it end up being a reputable source. And then you might have also seen this data right here. This comes from one of the first major studies conducted on health literacy. Lots of 33% of adults are unable to read basic healthcare materials. 42% cannot understand directions for taking meds on an empty stomach, and so on. You know, a lot of this data. By the way, all these slides will be available. If you want them later. But you know, this is scary data, and so you know, I want to give you all a big picture of what mHealth and mobile health looks like, and I'm going to continue that. But I just want to take a look at some of the resources now that the National Library of Medicine offers. Well, actually, I want to talk about patient safety first. This is a quote that comes out of a curriculum for medical students from the World Health Organization. Errors routine during the delivery of healthcare and occurs around 10% of hospital admissions. In proportion of cases, the harm produces serious, even fatal. This is all just to say that with better health literacy and better empowerment for patients, which I think wearable devices and collecting data about themselves can do, coupled with health literacy, you know, it can help reduce these errors, hopefully. So, MedlinePlus, many of you are probably already familiar with this. This is sort of our flagship consumer health product. It's an easy-to-read medical website for patients and their families. It has over 1,000 topics with links to authoritative health resources. It has a medical encyclopedia. If I could scroll lower on this page, you would find a button for lab test information. There are also many of the topic pages linked to patient handouts, and there's also a free companion magazine of the same name. And I mentioned this because this is a completely mobile-friendly site, whether you're on your phone or tablets. A couple of other mobile-friendly sites that, you know, I would argue follow under sort of telehealth, drug information portal. You can find information for over 70,000 drugs, probably more than that now. I think this is an older screenshot here. And it will link out, the results will link out to sort of all of our other products if you're looking for information about clinical trials, if you're looking for you know, general instructions on how it should be used, if you're looking for potential poor drug interactions. And I see a question in the chat. So drug information portal. So MedlinePlus, first of all, that's the URL for MedlinePlus. And then drug information portal, I'm also typing into the chat box here. To the right here is a mobile version of not drug information portal, but a related app called Pillbox. I really love Pillbox. I love showing that whenever I'm presenting or exhibiting. It's an app that lets you identify drugs by describing them visually. So the screenshot on the right is sort of the mobile version of that, which I accessed at night for some reason. And this is the desktop version of Pillbox. So you can search by name or ingredients, by the imprint that's on the box, by the shape, by the color, by inactive ingredients. So Pillbox is also mobile friendly. I find that first responders really like that, really like this app. And you might be able to imagine why if you're trying to answer a 911 call and there are pills laying around, or how many people here, well, you don't have to self-disclose if you don't want to, but I know a lot of people just keep a set of pills in a little plastic baggie that they keep in their bag that they take around with them. You may know what those things are, but not everyone does. So being able to identify it or look it up via Pillbox this is just a great application. Another resource that I like to show is Go for Life. It's a physical activity campaign for people 50 and older. You can subscribe to email and text reminders. So I think having those text reminders sort of gets it sort of that more digital health intervention. And the fact that it is a website that, like all of our other resources, is mobile friendly. Go for Health also has a toolkit with exercise guides and other principal materials. There's also a YouTube channel with exercises, videos, and personal stories, and YouTube is, of course, also mobile friendly with its own app. So Pillbox is a mobile friendly site. If you look at Pillbox, someone asked if Pillbox is available on both iOS and Android. You can access Pillbox on your phone, but last I checked the iTunes store. It's not necessarily an app so much as just a mobile friendly site. So let me go ahead and give you the URL for Pillbox. So this next page, this is from the iTunes store. These are all the apps that are listed under the National Library of Medicine in the iTunes store. Just one more app I want to feature here is Wiser Response. That's the second app here. This is a very, very mobile-friendly app. You don't even, once you download it, you don't need to be connected to the internet, which is great. Wiser is, wireless stands for, Wireless Information System for Emergency Responders. It assists with the identification of and response to hazmat incidents involving chemical, biological, or radiological agents. Wiser is available for multiple platforms, and it can be downloaded to mobile devices, I believe both iOS and Android. It is a system. It's a mobile app, so it covers disaster health, which is why I mention it. This is just a look at a wide cross-section of NLM apps. It's a system to design emergency responders in hazardous material incidents, and it has a lot of information on hazardous substances, including substance identification support, physical characteristics, human health information, containment and suppression advice, including personal protective equipment guidance. It also has protective distance estimates and maps, and role-specific information for first responders, hazmat specialists, EMS, hospital providers, and preparedness planners. One feature of the app, and so here's an actual screenshot from the app, is Chemist, which is the Chem Intelligent Syndrome tool to help identify or diagnose types of chemical exposure after a mass casualty incident. So this is, yet another tool, digital health tool out there, as are all of the resources that are from the National Library of Medicine. And here are a few more. So I did put all the URLs right here. You can take a look at that for a second. And I'm going to go ahead and paste in the Wiser URL to the chat box. And then if you're also looking for other mobile apps, you can see NLM.nih.gov/mobile. Okay, so moving on. So now we're going to move on to sort of other, what I think of as sort of, I guess I shouldn't call it other mobile health, but sort of digital health and public health. So I'm not sure if many of you are familiar with ProMed. That's a public, or ProMed Mail. That's a public health listserv. ProMed and sort of these digital surveillance systems. ProMed Mail is really interesting. If you want to know about the outbreak or the incidence of sort of any disease in the world, and also if you're not getting enough emails, you can subscribe to ProMed Mail, and I can assure you that you'll never be able to effectively sort through your emails again, not without some sort of sorting rule. But surveillance tools like these have been crucial, have played critical roles in informing public health officials of outbreaks like SARS, in 2002, or by identifying informal reports on the web through news media and chat room discussions or of things that have popped out. So that's a little bit about digital health surveillance. This author, Brownstein, or Brownstein, I'm not sure. He's written a lot about digital disease detection. So if you look up John S. Brownstein, you'll be able to find a lot about this if you want to do a deeper dive. Sort of on the cutting edge side of these, there's a tool. There's a tool for doing genetic analysis of viruses in real time. So this article, Towards a Genomics-Informed Real-Time Global Pathogen Surveillance System. So this is all about being able to analyze, Ebola within days rather than weeks, which is usually what happens when we're trying to do research and respond to an outbreak. So check this out too, Towards a Genomics-Informed Real-Time Global Pathogen Surveillance System. I'm not going to go over this too much because I see we're running down on time now. Is anyone familiar with this map right here? So I see a question here. Are any of these available for Kindle? Yeah, I'm not sure about its availability for Kindle. Okay, so many of you know what this is. That's great. So people wrote Caller in London, John Snow. So John Snow was an apprentice physician at age 18, and at that time cholera had struck London. People thought it was bad air or miasmas. It killed thousands of people. And that bothered him. And after becoming a doctor, cholera struck London again 17 years later. The theory of bad air never sat well with him. He thought that maybe there were tiny things that you couldn't see that could be spread by water or something. And he did, one of you wrote The Birth of Epi, and that's exactly right. He's considered sort of the father of epidemiology. He put together, he went around London and he collected information about where people were sick or dying. He did interviews with people. He essentially did the first epidemiological study when cholera hit, and he figured out, if you look on Broad Street in the lower right hand side of the screen, he figured out that the source of a lot of the sickness came from this water pump here on Broad Street. So I like to show this map because there's just one more tool I want to show you. It's called OpenStreetMaps. OpenStreetMaps was inspired by Wikipedia, so sometimes it's called the Wikipedia of Maps. It's a crowdsourced map. It's a free editable map. You can add data to it, add metadata to it. The reason why you might want to have something like this is because when we look up maps on any app that we use, Waze, Google Maps, a lot of those maps are restricted. I mean, they're owned by a company, whereas OpenStreetMaps is open to all. And when you're trying to respond to any sort of disaster or emergency, information about where resources are often distributed. They're in a lot of different places. They're not all in one place. So where you might find information about emergency resources and supplies might be different from understanding where there are service roads or alternative paths to get to a certain spot. So just to show you a little bit about what OpenStreetMaps looks like, basically your task, this is modern-day London, the satellite image of modern-day London. And one task that you could do if you're not entering data about buildings, the most basic thing that needs to happen is that you just have to understand what's a road and what's a building. So I was recruited by a friend who's doing Peace Corps several years ago who asked me to help map parts of a third world country that she was in that was unmapped. And so I got some friends together and we went to the library and we just started tracing around buildings and tracing roads that we could see using satellite imagery. This is sort of what the dashboard looks like. So this is a top-down view of a much larger region. Oh, someone said that they just used OpenStreetMaps at a local book festival. If I'm reading that right, that's great. So this is what the task manager might look like. So this is a grid overlaying a large region of a country, and you can see that it's been divided into squares. The yellow squares are places that are in progress. The green square has been completed. That means roads and buildings have been traced in all parts of those regions. In some of the squares, you can see it's been divided into 4 quadrants. So one of those quadrants might be the view, a view that you might actually work on. So it's really interesting to look into. It's all free. And so this is just, when we talk about mHealth, we're talking about a wide range of technology. So we started out with sort of wearable devices, and now we're in sort of tools that can be used for epidemiological studies. But when I first learned about OpenStreetMaps, it was in the context of the 2010 Haiti earthquake, and it was just incredible. There are volunteers across the world that participate in OpenStreetMaps. And in just a couple hours after the earthquake hit in 2010, from people who had never been there, millions of edits were made to the open map of Haiti, and they mapped the entire island from satellite imagery, which allowed relief workers to properly coordinate rescue missions and save many lives. While commercial maps had no way at that time of responding in such a short duration. So mHealth is, there's a lot to it, and this is one that I thought would sort of be a cool note to look at. So we've looked at some National Library of Medicine resources, and we've also looked at some of these public health technologies that are out there. And I guess this might be more of a personal opinion, but when I think of mHealth now, it's not Fitbit. It's not some of these consumer health devices that are emerging on the scene every single day. It could be something as simple as text messaging, which has been used for a long time. But it could also be tools like these crowdsourced tools that people are using respond to disasters. Okay. So does anyone have any questions or comments? Someone pasted in a link. And wrote, wearable monitoring has great potential for monitoring public health, but we also need to update HIPAA to reflect improvements in technology. Corporate wellness programs tied to health insurance like United Healthcare Motion and Blue 365 Wellness Monitoring. The insurers and device manufacturers claim these are voluntary and protect privacy, but these are obvious concerns about employers potentially firing those they consider unhealthy and insurers dropping those they deem high risk. That sounds like an interesting article. I of course can't weigh in with my opinion, but yeah, there's definitely a lot of interesting readings out there about mHealth. Someone asked about getting a copy of the PowerPoint slides. Again, please, you can email me at this. Address, and I'll get you a copy of my slides. I'll go ahead and type my email into the chat box too, so you can better copy that. I'm interested. I think the only technology that I talked about that lends itself to sort of crowdsourcing or to an event is OpenStreetMaps. And I guess I didn't talk too much about other programming ideas, but did anyone have any thoughts, or has anyone run sort of any mobile health or any programs related to mobile health or mHealth? Okay, doesn't look like it, so I'm going to go ahead and stop the recording now.